When I have a patient come in that has either multiple teeth missing or all their teeth missing, I think they are one of the greatest candidates for implants. The reason I say that is when we place a patient in dentures, if we have patients with natural teeth, we would consider them at 100% function. When we have patients with dentures, we would like to consider them as 10% functional, which is a large gap between what they're normally used to of natural teeth and dentures. So when we are able to place implants as roots in there that the denture or partial denture can snap onto, that percentage goes back up to 90%. So we're able to give patients back that functioning that they were used to with their natural teeth, and they don't have to worry about being in public and their denture falling out, or always having to put adhesive on their denture, or having their roof of their mouth covered. All of these problems can be fixed by anywhere from 2 to 4 implants based on the patient's jaw and prosthesis, but we can replace all their teeth with 4 implants, and they are almost back to what their natural dentition was.